Hi, this is Dr. Ramin Tayani, ophthalmologist, oculoplastic surgeon at the Tayani Institute. Welcome. I'm actually here with Maria Richardson, who's my surgery coordinator, manager of the department, who schedules all of our surgeries along with some other staff members as well. Today we're going to talk about laser resurfacing. We have two modalities, Active FX and the erbium, which we'll talk a little bit about the erbium, but also mostly about Active FX. So, Maria, do you want to say anything in general about the laser resurfacing, what it does, and why would anybody be interested in it?
Well, it is a laser resurfacing, so it takes off the top layers of the skin. So it kind of can take care of any sun damage that you have. It has a tightening property to it. It can minimize some of the wrinkles on the face. And then we have 3 different levels. We can go light, medium, and deep, depending on what you're trying to achieve. I think it's a great procedure. There is a little bit of downtime, but the effect afterwards, after you've healed, is beautiful. So I think it's a really great procedure.
Yeah, and I threw out the term erbium and Active FX. I'm just going to go into a little bit of the technology at a very superficial level. We have erbium and CO2. The CO2, the technology that we use is Active FX, which is the manufacturer's Luminous, and the erbium, we use the Fraxel. The erbium is used for darker skin. The Active FX could be used for almost all skin type, but safer with the lighter skin tones. I have a lot of experience, as you all know, with the Active FX. I've actually internationally lectured on it and taught on it. I've used it for over 20 years. The latest technology we've been using is actually about 10 years old, over 10 years old, 12 years old, and it does provide an excellent outcome with, Maria said, reducing the wrinkles. It's important to know it's reduction. It's not complete elimination of wrinkles, but it reduces the wrinkles, it tightens the pores, and it does all of that with the collagen remodeling. With that, you get tightening and rejuvenation of the skin. It has an amazing outcome. It can take 20, 30 years off of a skin.
It is amazing. It is.
So the worst part of it is the first 3 to 5 days, depending on how deep we go. As Maria said, we can go light, medium, or deep. So if you're a candidate to go deep, then you might need to plan on about a 7 to 10 day course of recovery. If we go light, 3 to 5 days, you can probably be at work, right?
Yeah, no, I agree.
How would you describe the pain the patients
I think on the deep, when you do deep, the pain level is probably a 6 out of 10, I would say, for the first few days, because it has gone pretty deep into your skin and it's taken off the top layers. So for my patients, they say it's about a 6 out of 10, I believe.
But that could be alleviated with either extra strength Tylenol or maybe a little bit of some kind of narcotic, maybe a Norco or...
We do prescribe the Norco or, a pain reliever for our patients just in case they need it, because we don't want our patients to be in pain. But generally, they start off with extra strength Tylenol, and they might alternate it with the pain reliever, the prescription pain reliever.
Vicodin or Norco.
Or Norco, yeah. So they'll do the Tylenol first, and then in 4 to 6 hours do a Norco, and then just keep going back and forth like that, ending at bedtime with the Norco so that you can get a good night's sleep. But generally, after the 2nd or 3rd day, you don't really need the prescription pain medication. That the extra strength Tylenol would be plenty enough if that is even needed.
And this procedure can be done on its own, standalone, or it could be combined with other cosmetic surgery or functional surgery. Many times I'm doing a brow lift or an upper lid or lower lid blepharoplasty for cosmetic or functional reasons, and the patient wants to get some improvement of the wrinkles, the pigmentation, the aging of the skin, and it's augmented with this procedure. If that's the case, the recovery is pretty much all done in one time, which is about that 7 to 10 day period. Maybe we should go into a little bit of what to expect as you're coming up to the surgery date, the surgery day, and then afterwards.
Sure.
So what are the preoperative...
Preoperatively, with this Active FX, the CO2 laser, you really don't have much to do except for about 2 days prior, we will prescribe an antibiotic and an antiviral. It's a 3-day course. There may be an occasion for a patient who maybe has any kind of viral infections that we may extend that antiviral to a 5-day course, but generally both of them are a 3-day course, so we'll start them.
And that's the cold sores. If you had a history of cold sores around the lips, then you would definitely want to let us know, because you're more prone to a possible viral infection. So we would put you on the 5-day antiviral.
Right. So you would start that 2 days prior and do it for a 3-day course. So that's really all that you need to do prior to the surgery. The day of the procedure, you would just
Actually, we should talk about one other thing. If they're having anesthesia, about food.
Oh, if you're having anesthesia, if you choose to go that way, you cannot eat 8 hours prior to the procedure because of the anesthesia, and you will need a driver to take you home. I would highly suggest having a driver whether you do anesthesia or not. If you have someone available, I think it's just a better decision.
It's a lot more comfortable that way.
Right.
Unless you're having a very light one with just topical anesthesia, yes, you can drive yourself, but it's always best, even if it's a little eyelid lesion we've taken off, we always tell patients, you don't have to, but it would be better to have a driver. The way I like to word it is, don't eat or drink anything after midnight, because sometimes even your schedule, if your surgery is scheduled, say, for 2 in the afternoon, there are times that things change last minute, and we have an opportunity to move your surgery up to 9 in the morning or 10 in the morning, and now you've eaten and you can't have the surgery.
That's right.
So it's 1 day of suffering. I would say just don't eat or drink anything after midnight, the night before surgery. If you do take medications, we do want them to take their blood pressure, right?
Right. So we will have a conversation if you do choose to do anesthesia. So the surgery coordinator would have a conversation with you about what medications you may take. Just like Dr. Tayani said, if you do take a blood pressure medication, we would have you still take that in the morning with a very small amount of water to swallow the pill, because we want your blood pressure to be regulated. We would also have a conversation about your overall health, and we would determine if you need to see your primary care doctor prior to the procedure to get a surgical clearance. We want to make sure that all of our patients are safe. So we would have that conversation prior to the procedure.
Yeah. And going through now the day of the surgery with the laser resurfacing could be anywhere from topical anesthesia, light sedation with monitored anesthesia care with an anesthesiologist providing sedation, like a colonoscopy or a cataract surgery, or it could be as much as even general anesthesia where we put you completely to sleep. So in any of those scenarios, the preoperative course we talked about, but the day of the surgery, if it's very light, or medium or deep, it doesn't matter. We can do the ointments if you want to just talk about that a little bit.
Sure. So after the procedure, you're going to leave the surgery center with a layer of what's called Aquaphor, which is a jelly type of
Vaseline
type of a compound that you can get at any over-the-counter, any store, any drugstore. You can pick that up. But you will be using that for the next few days after the procedure. We do also have you use a vinegar water solution as your cleanser that you're going to do about 3 to 4 hours during the day. So it's 1 teaspoon of white vinegar to 1 cup of distilled water. And that's your cleansing solution for the next several days. Right. We ask you, or we say that you can keep it in the refrigerator because it's cool and it might feel good on your face.
Yeah, a lot of people like the cold, and they put their gauze and dip it in the cold water.
Yeah.
So refrigerating the distilled water is not a bad idea.
Right, and you do use these gauze squares that you'll get from the surgery center. They're just little squares that you just will dab with the vinegar water onto your face to remove the Aquaphor, and then after you've cleaned that off, you're going to do another application of the Aquaphor. So you're going to be doing that every 3 to 4 hours over the next few days after the procedure until you've seen the doctor for your first post-operative appointment.
And you don't have to wake up in the middle of the night. We say every 3 to 4 hours, but it doesn't mean you have to wake up in the middle of the night to do it. But if you happen to wake up, then go ahead and do another cleansing.
Yeah, I just usually say during waking hours.
Yeah.
You don't have to wake up during the night.
Yeah, and then you could pretty much eat or drink anything you want afterwards. As far as the activity, you want to just...
Yeah, you want to stay out of the sun because remember this is brand new skin now and you're healing, so you want to stay out of the sun as much as possible, especially over the next few days, but then in the next few months as well, you want to wear a hat and have sunscreen on your skin once it's healed. But over the next few days, just kind of lay low. You don't want to do any activities that are going to get you really your heart rate or your blood pressure elevated. You want to definitely be able to keep your skin clean and maybe sleep a little bit with your head elevated, although that's not mandatory, but I think it's probably better with, to prevent any swelling, just to have it
anytime you
elevated.
do any surgery, it's always good to have that body area elevated above the heart. So as Maria said, it's not required, but it's not a bad idea to do that.
Yeah, and when you do sleep, just make sure you put a pillowcase on that you don't mind it getting messed up, because the Aquaphor is a little bit messy.
True.
And it will get on your pillowcase, but it is the best item to help your face.
Absolutely. And we've had multiple different products, but the Aquaphor does work the best with the least amount of any other issues, meaning allergies, etc. But if you're signed up for this procedure, you will have a thorough consultation with Maria or one of her team members and going through all of this. And we have kits that we also recommend, highly recommend. It's sometimes a little bit of money to buy them, but it's not much. It's usually between $30 to $100 and gives you the right, the best ingredients that we think will help you through the recovery period. And then we see you, the doctor usually sees you somewhere between 1 to 5 days after the procedure. So you do all of the stuff we just talked about during that time until you come in, and at that time we go through the next step of what needs to be done.
And of course, the surgery coordinator is always available with any questions or concerns during that time.
Yeah, and I always give my cell phone. If you need to contact me, if there's any emergency, you can call our main number, 949-489-2218, and then get the doctor on call. You can reach us, and or my cell phone is always provided to any of my patients that I do surgery on. What else is there?
I think that's it.
Pretty much it?
Yeah.
So hope this was helpful. It's a good reminder if you want to watch this before the surgery, to, again, as a reminder, and or even after the surgery, to know what's going on and what to expect. Again, it's Dr. Ramin Tayani and Maria Richardson. Thank you for watching. Have a great day. Till next time.